Hi, and welcome to our Friday webinar. We are back with Dr. Tom Tully for another fabulous session of Ask the Vet. Welcome, Dr. Tully.
Well, thank you so much, Laura, and glad to be here on our summer webinar.
Yes. Yeah, I was, because every time I put in the webinars for the website and stuff, I think it does like a number ticker. And I swear to goodness, for you, it was like we're on like webinar, like Ask the Vet, like number 23 or so. We're like, you're like a ridiculous high number of sessions we've had with, I mean in a good way, of sessions that we've had with you. So.
No, I mean, there's so many questions and there's always something new. I've been doing this, I have to admit it, 36 years, and
you started when you were a little kid, huh?
Yeah, Doogie Howser, for those that remember him. But nonetheless, every day it's like, wow, I've never seen that before, or you learn something every day. And so although we've done a number of these, of course the questions are a little bit different, and we get different aspects of each question. So look forward to it.
And you have a trip coming up, right? You've got the veterinary.
Yes. Well, actually, I have a trip. I'm going to the South Alabama Caged Bird Society fair tomorrow, and in Mobile. Anybody that's in that area, but that's my trip tomorrow. To see a number of great birds there, but also the Exotics Con is in Denver, and that's where we continue to learn. We continue to advance medicine and surgery to care for the animals, and learn how to do procedures. Things have changed dramatically over 36 years. My first AAV conference, which is now incorporated into Exotics Con, was in 1986, and sat at the table with some very esteemed colleagues, Helga Gerlach, Greg Harrison, one of the founding first president of the Association of Avian Veterinarians, and wrote and edited the first book of significance there as far as clinical medicine and surgery, and welcomed me in as a new graduate, but things have changed, and we're continuing to move forward with our knowledge to care for these animals. So fantastic. Looking forward to it again.
Yeah, from what I remember when I used to be able to go with Bird Talk magazine, I loved seeing the new up and coming vets that would go there to get their class credits, or as it credits, but they, like the bright-eyed the bright-eyed students with their little like lab stuff on and stuff. It was pretty awesome. The future vets.
Yes, very much so. And we look.
You take them under your wing, right? Like literally under your wing.
Yes, very much so. And networking and introducing them, and trying to again stimulate that interest that they have, because it is challenging. But these are wonderful animals. I was looking on, there was something on the internet the other day about this African gray parrot that was telling the owner, kind of wondering to itself why the birds, that there were birds outside, but it was hot. So if anybody has a chance to look at that, it's I think it's on TikTok, but I saw it on the internet, but it's an African gray going, oh, look at those birds outside. It's hot.
That's
inside. So
I'm sure African gray has opinions.
But anyway,
that's pretty awesome. Oh my goodness. All right, so we've got I already see like 8 questions in the queue, but I wanted to so this is crazy. We haven't had this happen before. There's like a little glitch in the Zoom, and it's not letting our chat feature work. So just want to let people know that for some reason there's no chat feature option for y'all. I don't know what that is. We'll try to figure out in the course of this webinar. But so our Q&A button feature works, so that's good, because that's where all of our questions should be funneled to anyways. But for some reason, looks like the chat feature isn't available. So I'm not sure why, but we'll try to figure that out maybe as quickly as possible. With that said, I do have a question out the gate for you, and this one is, okay, you ready for this? It's about kidney disease and feather destructive behavior. Is there a connection between kidney disease and feather destructive behavior? So they have a 25-year-old umbrella cockatoo hen that started picking at 10 years and progressed into pulling and eating the blood feathers, either those or her mate. So she stopped after we lost the mate to an infection, but started picking blood feathers again on her Moluccan hen. So she has very wet, watery droppings, went through E. coli, and okay, and is it Enterobacter infection for the entire flock, except 2 birds last summer. So do you have any thoughts, ideas, what's going on? Is there a connection between the kidney disease and feather destructive behavior?
Well, really, just to be, right off the bat, yes, there can be, there could be a correlation, just with any disease process that may be internal, may be affecting one of your major organ systems, body systems, that could be really clinically evident over and above maybe watery stool, and this where it's more of a polyuria or increased urine output, but it's kidney disease could be renal disease, and like I said, anything else that is would affect the internal organs or body systems. Then what you look at is that you look at what is it, and there were some bacteria that were isolated. How are the bacteria isolated? Through a cloacal culture, and it was associated with the kidney. Well, it's, the cloaca has the digestive system coming through it also, so it's hard to really specifically identify the kidney as that where that bacteria would come from. With renal issues, it's somewhat difficult also to find out renal disease based on a chemistry panel, blood testing, what you would do is, if you suspect renal damage or renal issues, is that or renal disease, is that imaging, sometimes CT imaging, but really to look and really get a grasp of what's going on is a biopsy. And that is to go in endoscopically and get a biopsy, and that is not an uncommon procedure, because that is really the only way you can truly assess what's going on with the kidney on that. with mammals and other species, they have a bladder, and so you can get a urine sample, a clean urine sample. And so with birds, you really can't get a clean urine sample unless you do a colostomy and divert the digestive system away from the cloaca. And we're not going to do that. But nonetheless, that's what would be kind of in order to try to assess that. But it could cause, and the bottom line is, it could be related to the feather destructive behavior, but you would have to try to find out exactly what it is, and if you do suspect renal disease, and so that it could be treated properly if it could.
Okay. All right. And then we've got a question about a budgie that might Anne wants to know, could her budgie have liver disease? He's 3 years old, and they've had him since he was 4 months old from a large chain pet store. He was on an all-seed diet, and then when he was 1 year old, he was converted to a diet of sprouts, cooked grains, fresh herbs, and 25% seeds. He spends a lot of the day napping, but doesn't play with his toys or the other budgie. Doesn't sing or chirp much. He eats and he throws up, and he opens his beak and the food falls out. And then he goes and eats a bit more throughout the day. He makes kind of like stretching motions with his neck. He comes out of the cage, flies around, appears to have a bit of a belly. Had an exam with his avian vet in February. She didn't say anything about his liver, but said he has good musculature. And he's had a few stool tests for AGY, but they came back negative. And vet said he may be overstuffing his crop. And Anne's mostly concerned about him napping all the time and not chirping, and wants to know how they can help their little guy. So, little budgie.
Well, one thing that kind of have to do is first of all determine what's normal, and it had him for 3 years. Has this behavior been there since the bird purchased the bird, had the bird, and or has there been a change over time? And is that change associated with getting another bird and putting that in there? And now he has, has a buddy, but the buddy may be, not really what he wants or the bird wants. And there could be some type of a behavior situation there. Taking the bird in to try to get an idea of what may be going on to your veterinarian is fantastic. Good musculature means good body condition. You look for the muscles, especially the pectoral muscles, where you have 20% of the flighted bird's body weight, and you check that. Just think of a chicken or a turkey, and you have big, breasts, as far as the pectoral muscles are concerned. And so that's how we kind of look on flighted birds to determine what their body condition is. And if you have a good where it's even, then kind of coming from the keel, then that's good body condition. And if the keel is very prominent, then it's poor body condition. But your bird, it appears it's in good body condition, and that would usually correlate to the weight would be normal. Okay. And so with all of this going on, is that weight normal, and is the bird maintaining weight? If it is, then it is eating, it is digesting food, and it is maintaining its body weight. So then you look and see, because you said AGY, and for those who may not be familiar on the webinar with what that's avian gastric yeast. Okay. And so avian gastric yeast is something that is common in budgies. It's also called megabacteriosis. And so this is sometimes you will not be able to see that on a fecal, or sometimes even we'll do a crop swab to try to see it, and we don't see it there, but it's still in the stomach. Okay. It likes that environment of the stomach, but you can sometimes get it in the stool. You can sometimes get it in the crop swab. But if you don't, it doesn't really mean that it doesn't have it. But usually birds that have clinical signs with avian gastric or gastric yeast, that what you have is a situation where the birds are going light, and going light just means that they're getting thin. So you have a bird that's in good muscle condition, and so it's probably unlikely that that's a situation. but you do have this regurgitation. It appears one of the things with budgies that depending on how and when it occurs, it can be a behavioral issue. They will, if they're amorous to a mirror in their reflection, they can regurgitate. If they have another bird in there, they have these little plastic budgies. I don't know if they still make them, but I know that they can attach to the perch. They can fall in love with that little plastic budgie, and they can regurgitate. So that's a behavior issue that can be associated with it. And also it has kind of a mix of in a very diversified diet, and it appears it's doing well, but there could be something that it's eating that just maybe doesn't agree with it, but not enough to reduce its body weight. So those are all things that are involved with that, as it would relate to the possibilities of the regurgitation on that budgie. And if one thing that that can always be done is a culture to see if there's anything within the crop that may be irritating it, some kind of a low level infection that by a bacteria that would be causing some little bit of inflammation that would cause it to regurgitate, but not enough to reduce the weight. So that's another possibility. But yeah, good question, and it's good that you have the little bird is maintaining its body weight, and it seems to have good muscle condition. Yeah.
Okay. Now I got another question about one of the smaller birds that we typically keep as pets. A very popular one, cockatiel. So Art says last month. Sorry. Last month, the 1.5-year-old male cockatiel was molting. They noticed they made a little sound while he was grooming. Took him to the vet, who said his feathers were full and seemed well. Molting is over, but sometimes when he grooms, he yelps. He's not pulling out feathers. He's not in distress, just eating well. It weighs 99 grams. Yeah. Continues to be playful. His main diet is nutri-berries. Is the yelping while grooming normal? Is that something they should be worried about?
Well, the one thing that I would, it's kind of difficult because you're not watching the bird necessarily, and then when the bird yelps or makes a noise, that then it catches your attention, and then, but for the most part, I wouldn't say it would be a problem unless there would be one particular area that the bird keeps going to and that it's bothersome. Normally, if they're with most of the patients, if there is an area that's irritated, and that's similar to a broken blood feather that would be somewhat painful or irritating. That's like a surgical site. If we have to remove or do surgery and have an incision, the birds will normally not leave it alone. And that's why sometimes we have to put some kind of protective device around the neck so that they don't pull the sutures out or bother it. So if the bird in general is not focused on one area, or when this happens, then I would normally say that really it isn't an issue if all things are fine otherwise. The legs, the perching, the wings, and everything like that. If everything else is fine, then I would think that that this would just be something, that isn't a significant problem.
Okay. And the next one is about two Timna African. They have two Timna African Greys. One's fine. The other started shedding her tail and wing feathers. And then after molting, she only got some of her regular body feathers back. So she now has a couple of wing. Let's see. She only has a couple of wing feathers, only one of which is long, and only two shredded tail feathers. The other Timna's fine. They both have the same diet twice a day. They get fresh water, Volcamin, Avian Science, super seeds, and pellet berries, a bowl of fresh veggies, and a quarter of the bowl is fresh fruit. So, it could be going on.
So as far as the feathers not actually coming in at this point in time, really, and irregardless of age, on this, the feathers not coming in, if they're on a good, it sounds like a good diet, that for the most part, I would say that there would be a delay in those feathers coming in. As it would relate to why they wouldn't, the possibility of germinal tissue at the base of that follicle would be damaged, and so there's always a possibility when we talk about pulling feathers that you could damage that germinal tissue. For the most part, I haven't, there hasn't, over the years, I've had to pull feathers for a number of reasons. Sometimes due to birds that have feather destructive behavior that really just crush the feathers all and really chew them all the way down to the opening. And it's going to be difficult for that to be pushed out of that follicle as the new feather develops. So, for a number of reasons, I've had to pull feathers over the years. And there's really only one case where pulled feathers on it was a raptor that came in that had it was electrocuted or something of that nature, and the feathers were just totally destroyed, and pulled some of the primary flights, and those did not grow back. And
Oh, wow.
so it's so it can happen, but when you pull a feather, but it most of the time it doesn't. So unless there was something that really reduced this bird, really damaged that feather follicle, then for the most part, I would say that they would be delayed, and they will come in, but they just haven't yet. Usually you say, well, what's the time frame? Well, from the time that a bird molts to the time that the feather grows back is usually about 6 weeks, maybe a little bit longer in some of the bigger feathers, but you're looking at about a 6-week period. That's normal. Can they be delayed? Yes. Different things can occur, but for the most part, that's what you're looking at as far as the time frame on that regrowth.
Okay. And then this question, for anyone who has cockatiels can probably relate. This is from Bonnie. She says that her cockatiel has mega feather dander. He showers multiple times a week. They have an air purifier running. The vet suggested aloe for him. Is that something that you've heard of? So aloe for feather dander?
No, so I'm trying to, the one thing is how do you apply it? It's kind of a gel most of the aloe products that I'm aware of. I don't know. The one thing that I would say is that the cockatoos are in the cockatoo family. And I think some people may classify them as a small cockatoo, but anybody that knows that group of birds or has been around it know that they have a lot of feather dander and feather dust, if you will. And with that, I would say the really a good recommendation is just water. If you want to just give it a bath a day, if the bird is amenable to that, then that would be something to kind of reduce it. That feather dander really helps with the that's why, you look at a cockatoo's feathers, it looks like they're almost painted on a very healthy cockatoo. They just flow. There's not like a disruption in the level of those feathers, but nonetheless, it's a healthy, I guess, just bodily function on that for the bird. But you can reduce it, I think, just with water. Just spraying it and like I said, if the bird's not afraid of it, then that would be something to consider. The aloe, I just don't know how it would be applied, and if it would be in really anything to stick the bird's feathers together or anything like that. I just think it causes more issues than not.
Okay. Kind of reminds me when some people suggest that when you have like a old world, new world species in the same household, that sometimes they can have allergies to the dander and dusty birds can.
Well, that's possible. We did, it was kind of, do birds get have hypersensitivities, because it all relates back to our concerns with feather destructive behavior. And so want to try, and it's multifactorial. We already talked about the possibility of organ disease. We talked about renal disease. Could it cause feather destructive behavior? There's been claims of parasite problems. Anything that's really causes the bird to not feel well and be stressed due to a disease condition. How does it respond? And often we believe that that they can respond to feather destructive behavior in with disease conditions through the stress involved or pain that may be associated with that in feather destructive behavior. We know that there's behavior issues where I mentioned the person brought the baby home. The next day, the bird was, pulled all his feathers out. And then the same bird got used to the baby, and then feathers grew back, and then they brought a dog home. Next day, the bird's feathers were all pulled out. So in any, with any of this, that the feather destructive behavior can be associated with that. And then we're talking about the hypersensitivity when you're talking about the old world versus the new world, where the old world would have more feather dander. And we did studies to try to actually identify this. And I think that it's generally accepted at this point that birds do have hypersensitivity reactions. We just don't know how to identify it, because the birds, we can't do a hypersensitivity test because they just don't have enough body like a human would have, where you see if you're allergic to dust, grass, or what have you. but that it possibly could be related, whether it's food related or whether it's something in the environment that would cause the birds to have feather destructive behavior.
Okay. All right, and this next one comes from Frank about research regarding why an Amazon suddenly enter a hyper excited state and can bite rapidly, and then a few minutes later they return to their calm state, calm selves. So what would cause an Amazon to suddenly change its behavior into biting?
The Dr. Jekyll, Mr. Hyde type thing.
Exactly. Yeah. Amazon seem to be especially good at that, don't they?
You know, when anybody ever brings that up, I think of one of our students' husband had the Amazon bit him right here on the cheek and left a nice mark on the cheek, and he couldn't. He couldn't restrain himself from getting the Amazon off as quickly as possible. So they brought the bird in for an exam that thankfully there was nothing serious of his removal of the bird from his cheek. But nonetheless, it can occur. And so one of the most common reasons that I'm aware of is that, and particularly male Amazons in the spring, and you can, you know, put the spring from whenever to whenever, the hormonal activity as it relates to their reproduction in this time period will cause the will result in the males having this hormonal effect in their behavior, where they're so nice, and they can be nice, and then boom, bite you in the face, bite you through the lip, or something like that, or bite you on, you know, on the hand. So this is one of the one of the main things that I've seen with and had and witnessed with Amazons, particularly males in the spring. And then it gets back to the point where this was occurring, and there was thoughts of, well, what about castration of the Amazon, so that they don't have these hormonal effects on that. And there's much, it's not that easy in a bird. And there are also physiologic aspects of that occur through castration, possibly weight gain. They are susceptible to cardiovascular disease that may make them more predisposed. So there's all different aspects of that. So that's not a recommended practice, but that was broached as far as with this particular behavior that was mentioned with the Amazon. You're muted. I don't.
Sorry. Yeah, I got voice. Sorry. Yeah. I just wanted to, throw you off for a sec. See if you can read lips. Okay, so our next question comes from Laura. Says, my bird has a constant sneezing and 5 nasal flushes so far. Avian Vet feels it's environmental and has suggested a warm mist humidifier. They're finding that the warm mist humidifiers contain Teflon, which is the PPFE, which they can be harmful to birds, right? Can Teflon in the warm mist humidifier get hot enough to produce the toxic fumes that's associated with Teflon, PPFE? And do you know of any warm mist humidifiers that do not contain Teflon?
I would believe under normal circumstances that it probably would not get a high enough temperature that would cause the Teflon to actually and actually go out into a gaseous state that the bird could inhale. However, if there's no water going through, that which is just like a Teflon pan. Under normal conditions, if the Teflon is not burning or there's no water in there, it's not going to actually go into a gaseous state that the bird can inhale. But it's when it's just no water in there and the birds and the Teflon vaporizes, that is when it's toxic. And so possibly if there's no water going through this vaporizer, I'm not that familiar with the warm air vaporizers, but if there is no water going through and the heating element is still there, then it possibly could start get to a high enough temperature for that Teflon to vaporize and cause a problem. There's nothing wrong. I mean, we haven't used those, but there are what we call nebulizers that you could use to just kind of nebulize and kind of increase the humidity within that enclosure that would possibly serve the same purpose, and you wouldn't have to worry about the Teflon with that. So that's what my thoughts are as it would be related to that. Some of these sneezing situations can be very frustrating for you as the owner and frustrating for us as the doctor, because it doesn't take much to as we all know, to kind of irritate the nasal passages to sneeze. And so something within the environment, a seed husk or something that gets up into the nasal passages, and then the nasal passages have been flushed and there's no evidence of any type of infection or anything like that, then it's somewhat difficult to try to identify it, what would cause the sneezing. Sneezing occurs just like it does with us, and so it's a normal bodily function for birds, but you just don't want, if the bird is constantly sneezing, obviously that's as problematic for them as it would be for you if you were constantly sneezing and would need to take that, get that resolved. And so with that, it's a cockatiel, I believe, Laura, right?
Yeah.
Yeah.
Yes.
And sometimes it's.
Oh wait, I'm sorry. I apologize. They didn't state which bird, but yeah.
Who?
The one about the humidifier. They didn't state that what species of bird it is.
Okay, with I was saying with the sneezing, you can only look through the choana. Sometimes you can, the choana is the oral nasal interface in the upper beak where the sinuses drain down into the oral cavity. You can you can sometimes look in the that area if it is a big enough bird with a endoscope. You can look in there to see if there's anything, a growth or anything that may have lodged in that. And also if it's a bird of size, imaging, a CAT scan, CT imaging, to look at the sinuses to see if there's anything growth. That's where you go, depending on how problematic it is and what is involved. Because like I said, you can look at and have something that it inhaled or lodged in there when it was eating into the choana. You can have a bacterial infection, and then you can also possibly have an abscess or a tumor in there. And all of those have been found in birds. And also within the environment, you think about the environment within the house. We've had birds with, I think we've talked about some of the plug-in air fresheners and things we had last time, but within the house, is it something that the bird is inhaling, not just within the cage, but within the house, that in the environment in which it lives? When you say, if you put me next to a cockatoo, I may be sneezing all day, right?
Yeah. Yeah.
So that's something to consider and look at.
Yeah. By the way, it's a mustache parakeet.
Yeah, something with, very, very, a very pretty bird.
Yeah.
Yeah.
Right. Okay, it looks like we're on a theme here with sneezing and dander and environment. So we got a question from Helen about, can you recommend what they might give their African gray for her molt? She is preening a lot, especially on her back. Suspect that she might have dry skin or is very dry. It is very dry there in the summer. So they mist her with water. Are there supplements, foods, or something other than water that can to use to mist her?
Well, again, there is as far as the molting is concerned, it's normal. The feathers are coming out, and as they come out, there's going to possibly be a little irritation with the new feathers coming out and the old feathers being molted. And then there's if you look at a lot of birds, the smaller little pin feathers that they have on their head and in different areas of the body, they get new feathers. And so it's going to be somewhat normal for them to have a little bit more possibly aggressive grooming when they're molting. As long as it's not just totally where they're just overwhelming. It looks like there's an issue with that, but it could be a little bit more aggressive. And with that, the good nutrition is very important. And you're talking about the situation of misting. Yes, misting is not going to be a problem, and if the bird again is amenable to that, then by all means they enjoy that, and this is part of it. Then also you're talking about supplements. There are again, as I've stated, we don't know what the general daily requirements are for the birds, and the birds, even if you give them a diversified diet, for the most part, they have a tendency to pick and choose what they want to eat. And then you keep some of that diet in there for a longer period of time. They'll pick what they want, and then they'll eat on down the line, so to speak. Yes, I like this is my favorite, and then okay, my favorite's gone, I'll eat my second, and then go down. And so you have a tendency to have that, and so you get that nutrition as they eat what they want to. And again, my most important question isn't necessarily what you're feeding, but what is the bird eating? Okay.
Sure.
I want to know what you're feeding, but you could be feeding the best diet in the world, but if it's only eating X, then that's the only nutrition it's getting. And so if you want to really bolster your nutritional offering, then you can utilize supplements. And I am not adverse to vitamin supplements if you apply them and you give it to the bird as it is recommended on that product. And as I've said, I've recommended the Lafeber, the VB13 multivitamin, and then also the Necton products. And the Necton product does have a feather supplement, and that is separate from their multivitamin. So that is a great question, and yes, and the birds will possibly be a little bit more active in their grooming behavior during their molt.
Okay, all right. Are you ready for it? So this one's kind of a heartbreak question, and it comes from Ronald. They have they had a 44-year-old African gray male that had a minor stroke 6 months before a major fatal stroke on June 5th. Are there any medications that would prevent a major stroke in African gray? And how do they work? So and they want to know, is 44 a long life for a gray? So this backstory is their gray Ernie had a shower on June 5th and then had a stroke on the sink counter. Happened really quick, and the stroke, his left wing and leg was sagging. So they picked him up, and then the gray let out 4 loud screams as they're carrying him over to the table. They want to know if they did the right thing by picking up the gray, or it would have been better not to pick him up. And can hormonal conditions cause a stroke in older grays? So yeah,
a lot of questions there, but
yeah, a lot of story there, but
yeah,
that's
sorry. So I'm going to try to answer those, and thank you for sharing. Yes, sorry to hear about Ernie, but 44 years is a long time, a long life for a gray. Average, I would again, we've talked about this in the past, but medium-sized parrots such as African grays, Amazons, the average life is in my estimation, and based on my time working with birds, is 30 to 40 years. So 30 to 40 years. So Ernie lived 4 years longer than what my on average life. Now that does not mean, again, I emphasize this, that I say 30 to 40 years. As you said, Ernie lived 44. Somebody out there says, I have an African gray that's 52. And there was a lady in France that lived to 120. Okay. But what's the average life of a human? In the US, females are about 81 and males are about 79 to 80. So that's the average. Okay, it doesn't mean somebody can live longer. So 44, yes, was well lived life, and obviously you took really good care of them. Now, getting back to the stroke, African grays, just like a number of birds, are susceptible to cardiovascular disease. And you can think of it similar to a human. We can anthropomorphize here. They get cardiovascular disease. Cardiovascular disease can result in really heart issues, and also it could result in what they call claudication, and that is when the arteries, the major arteries, are so blocked that if the bird gets excited and the blood pressure goes up, that there's not enough blood flow that's allowed to the legs, and then the bird cannot perch. It becomes almost paralyzed in the legs. And then when the bird settles, when the stress is reduced, the blood pressure is reduced, and they have blood flow that's adequate enough that the bird regains its ability to perch. So this is something that can occur. And on top of that, a stroke, where you have issues where you have reduced blood flow to a part of the brain that causes seizure activity, or where you have paralysis, or you can have both with that. Now, asking, is there anything that you can do about it to prevent it? You can prevent, again, proper care, proper nutrition is the preventive measure for cardiovascular disease. Now, when you're looking at you can do the preventive measures. I can do everything I want to try to maintain health, exercise, run, supplements, good nutrition. And when I'm 100, the body is still going to be 100 years old. It's so when you have the bird that's lived to 44 years, you've done everything you can. Now, if you do have, so there's not like any medication or anything to kind of reduce the incident of the I guess the cardiovascular disease, so to speak, say like Lipitor. Oh, well, we need to reduce, we got to give it Lipitor. And so we're still doing research to try to determine some of the if birds can even get therapeutic doses of that, if that's something that we need to do to reduce the cholesterol, to reduce their chances for cardiovascular disease. We're not there yet, but the cardiovascular disease research is continuing in birds on that level. But if the birds do have a stroke, and we had one here that was identified through an MRI, we can actually identify that the bird had a stroke, and there is seizure activity associated with the stroke afterwards because of brain damage that's associated. The bird was not paralyzed, but there was seizure activity. Then we had the bird on anti-seizure medication that was very helpful. So that was the case with that. So again, very helpful with that after the stroke. Now, the other question that you had that I can remember is that should we have picked it up, or was it and really this is a situation where the bird has no idea what's going on. And so if you were close to the bird, if the bird was and even if you weren't, I think if you picked up the bird and you cuddled the bird and you held the bird, that would be my opinion would be helpful. And so I think that usually with something like this, if there is a seizure or something, that it takes some time after the seizure, the bird would recover, but having somebody that would be saying something soothing to the bird, that would be holding the bird, that would be very beneficial.
Wow. Yeah. Okay. Yeah. All right. Next question is from Sandy about her 24-year-old female eclectus who was diagnosed with PDD based on X-ray and barium X-ray and GI symptoms. Basically, she couldn't poop for like 48 to 72 hours until she put her in a sink with warm water, and then she exploded. Her droppings before that were odd, very watery, odd color. No regurgitation, x-rays showed bad arthritis. Vet number one, and unsure how to diagnose. Vet number two thought PDD. Celebrex and Medicam helped after a few weeks. She's like pooping again. They're wondering, they're questioning the PDD diagnosis. She gets lots of infections, but is alert. Any thoughts on other illnesses or viruses that could be having these kind of symptoms?
Yeah, there's many. There's many. But the one thing that I'll say is that PDD, proventricular dilatation disease, is something that can cause certain clinical signs that are associated with the gastrointestinal tract, hence proventricular dilatation disease, and can affect the nerves and other parts of the body. But primarily we see clinical signs associated with that. There's only, there's proventricular dilatation disease, if it's diagnosed pathologically and has been over the last 10, 15 years, has been with the really with Bornavirus, it is seemingly associated with that, and we're still looking at that, but it appears that is somewhere involved. But with PDD, proventricular dilatation disease, that can cause the signs that you were talking about and described. There's a number of other things that can cause similar signs that you were talking about. And so being able to diagnose a PDD, or proventricular dilatation disease, and to get a definitive diagnosis would often require a biopsy to get possibly a crop biopsy to get a definitive diagnosis as it would relate to the pathology that's occurring. Because when you're looking at this, what you're describing, it's a little bit more complicated than just going on the radiographs. Although if the proventriculus is like the size of the globe and there's no other room, then that's a fairly good indication that that's what the bird has. But if the proventriculus is normal size and you just have general GI, or it's kind of suspect, then on enlargement or not enlargement, and you just have general clinical signs that you describe, and the bird is maintaining its body weight or what have you. Usually with proventricular dilatation disease, the bird is eating, and the muscles that kind of contract in the digestive system aren't working properly, and so it just keeps getting bigger and bigger and bigger, and because it's not contracting. And while the GI tract is not working, then what happens is the bird loses weight. So any number of issues can cause some of the problems that you had, infectious diseases, and then that takes other tests and stuff like that. But yes, very good question. But proventricular dilatation disease could cause the signs that you're talking about, and there's others that could also. One thing that we do is contrast study on birds. We'll give them barium, and then we'll put them in a little box on a perch, and then we will look at them on a fluoroscopy or a C-arm, and we'll take a radiograph, and we'll watch that bird just sitting there on the perch, and then we'll take images to see how well that GI tract functions. And so we look to see if the barium will go from the crop, and then it'll go down the esophagus, the thoracic esophagus into the proventriculus, and we'll watch it go through the intestinal tract to the cloaca. And what we'll look at is that the normal passage of time for that barium to go through. And if it just stays in the crop and it doesn't move, then we know that it's very, again, likely that we're dealing with proventricular dilatation disease. We don't see it much here, but we know it's out there. We don't see polyoma much, but we do get cases. So, but anyway, I hope that kind of gives you a little bit of help on that.
Wow. Yeah. We just breezed through a bunch of questions today, and now believe it or not, our time is up. But
it's up.
Yeah, we reached the hour.
You just started.
I know. I feel like we did just start. Well, the good thing is we have you back next month, but a week earlier than usual. So we're gonna have you, I believe, in the middle of the month instead of the end of the month. So I'll give you the exact date. Do you know your exact date? I'll find it.
I think it's the 19th. Yes, I see it right here.
Yep, you're gonna be back with us on the 19th. So
yes, right after Exotics Con.
That's right. So you have Exotics. There's so many bird conferences coming up. I was gonna tell everybody that AFA convention, the American Federation of Aviculture, is this weekend.
Wow.
But you can they're gonna have it live stream at afabirds.org. So afabirds.org, you can live stream that. So yeah, that is, I'm sorry, not this weekend, the next weekend. So don't log in this weekend, but following weekend, go there. And then, we have a winner today of our giveaway, which is going to be the Lafeber for the foraging packs. That's going to go out to Laura Cohen. Congratulations to you and your bird. Hope you enjoy those. See what varieties of Lafeber food that your bird enjoys, because it has a nice selection there of all the foods, and make some foraging fun too for your bird. Let's see what else I have. So sorry everybody that our chat feature, I don't know what happened to Zoom today. They just took our chat feature away from us. So we'll hopefully get it back for the next go.
Yeah.
And speaking of that, so we do not have a webinar next Friday. However, we will have one August 12th. So August 12th, Lisa Bono is going to be joining us, and she's going to be talking about managing a multi-bird household. So I'm sure a lot of people can relate to multi-bird households, because I believe we do have a lot of multi-bird stewards that join our webinars. So if you have more than one bird, you want to check this out. On that note, Dr. Tully, I know you've got some busy travels. You've got some conferences coming up this month in August, right? So, all right. Maybe we'll have some latest findings reporting back from when you meet up with your colleagues to talk about bird health. So.
Yes, and try to mention a few of the highlights of the conference. So
nice. Okay, that would be awesome. I mean, can you imagine if we did an Ask the Vet with like you and a panel of all your friends, like an after hours, event at at the conference at the Avian Vet conference.
Yeah.
But all right.
So looking forward to it. Looking forward to sharing next month.
There you go. We'll see you sooner than later next month. So everyone, if you have any questions, ask in mid-August. Here we go. All right.
Yes.
On that note, I was going to say thank you once again, Dr. Tully. It's always a pleasure to talk with you on Friday, see these fabulous questions and fabulous answers. And
yes. Thank you, Laura. Thank you, and all of the attendees today. The great questions. Great questions. Yes,
for certain. Okay. On that note, everyone have a fabulous weekend. All the best to your flock, and then stay safe. And then until next time, bye.
Bye.